Hello. Welcome back to Revive 360. We're excited to be here. We're bringing, women's hormones tonight. So we're going to talk about women's hormones for the next 30 minutes. Have questions, again, you can go in the chat and ask any questions. If you have any questions while we're discussing any of this, you can also email your questions prior, and that's at admin at azrevive.com. So when we're talking about our next topic, you can always email questions if you have questions prior to whatever our topic is. But tonight we're going to talk about women's hormones and why it's so important. And it really starts at puberty. So puberty, and because we're going to talk about women, I mean, not that boys don't have hormones too, but tonight we're just going to focus on women's hormones. But a lot of times you go into puberty, and puberty is when all these hormones start, having you produce, the hair under your arms, pubic hair. You're starting to get your menstrual cycle, grow breasts, and when you're starting all of this, it's all new. So, it's normal to have irregular periods and cramps and, all these new things. But a lot of times with these young girls, as soon as they go to mom and say, oh, my cramps are so painful, I can't go to school, they're irregular. Well, of course they're irregular because you're, 14. That's normal. Your body's trying to learn how to cycle that. So, but what a lot of times do is, as parents, we rush them off to their primary care doctor and tell them, oh, they're having painful cramps. Their periods are irregular. And then what a lot of providers will end up doing is putting them on birth control. Well, when you're putting these young girls on birth control, you're essentially just putting them into menopause. You're giving them a bunch of hormones to stop them from having periods or making them more regular. So you throw them into menopause, and we do that through their adolescence. Then they hit their 20s, want to get married and have babies, and then they're having the issues of fertility problems. They're not able to get pregnant. So they're back to the doctor saying, I want to have a baby. I can't get pregnant. So then we throw a bunch more hormones back at them and expect them to conceive. Well, if they do, they get pregnant, you get 9 months of all these hormones and you're feeling great and you're having all these hormones. And then all of a sudden, within, a few hours, you deliver this baby, and with the baby comes all your hormones too. You're essentially now hormone depleted. And then we send you home, and 2 weeks later, you're back at the doctor because now your hormones are depleted and you're having postpartum depression and you're sad and you don't know why. And you go to the primary care, and what do they want to do? They want you to put you on an SSRI, a Wellbutrin, a mood stabilizer, because now you're postpartum. Instead, had they given these patients maybe just a little bit of hormones and get them boosted back up, they would feel great without having to put you on some kind of medication. And then you get through your baby making years and you get to your 40s, and you basically go through what we call cougar puberty. It's basically puberty backwards. So again, your hormones are fluctuating all over the place. And this is really when a lot of women should be put on hormones. And the big misconception now is, in the past, has been hormones cause breast cancer. And that's what we have all been told for years. So we've stayed away from putting women on hormones. Well, tonight we would like to debunk some of that and let you know why hormones are so important. So with that being said, I know I probably didn't introduce myself, but I'm Trinity. This is Price. And Mariyah's here. She's our nurse practitioner, so she'll probably be going over a lot of this with you. I'll just kind of ask some questions that I think you guys want to hear, and these two can answer. Price can go over. We have a whole variety of supplements besides our hormones that we do offer here as well. Yes, a bunch of good stuff. But definitely some support, hormone support here. So with that, let's get started. So hormones aren't just for reproduction, right, Mariyah? Like, what are some of the, I know you're kind of become the hormone queen at your other job, but what do you find that women are coming in for?
Weight gain, fatigue, brain fog, lack of sleep, mood swings, hot flashes, night sweats, low sex drive, vaginal dryness.
Just
XYZ.
that list affects everything in your life is pretty much what you just.
Any unexplained symptom is usually hormone related, is kind of what I'm finding a lot of the times.
So I know we talk about it a lot. It was the Women's Health Initiative done in the 1990s, where they took mostly all it was the first time women were allowed to be in a study. And then they only picked women over the age of 65, and you didn't know if they had any precursors to any kind of cancers or health problems, osteoporosis, heart disease, anything like that, because they're over 65. So they could obviously have some of those already, building up or have them already. So they took those women and then they gave them estrogen and progesterone, but they were synthetic, made from horse urine. And we don't even give patients that now, do we?
I stay away from it. Synthetic hormones obviously is what causes the scare for cancer, concerns for other issues. We go more so bioidentical.
So had they actually done the study the right way with bioidentical, they probably would have never gotten the skewed results they did. So they tested these women over several years, and there was a very small percentage when they gave horse. So they made these synthetic hormones out of horse urine, which is synthetic hormones. We call them horsey hormones. And we injected them with estrogen and progesterone. Now, those two together, there was a small incident of breast cancer in the women that got both of those. But again, they were over the age of 65. Not sure if they already had it or not. And then it's not even the hormones we actually give people, right?
Agreed. And I think there's a much deeper dive to be said between hormones and various cancers, because cancers automatically have estrogen and progesterone receptors on them. And it does not necessarily mean that the HRT is what caused said cancer. And honestly, those patients benefit more from HRT than not.
Yeah, that's what we had talked about, was estrogen and progesterone actually are estradiol and progesterone are obviously cancer protective, they're brain protective, they're bone protective, and they're heart protective. Mm-hmm. And cardiac is still the leading cause of death in women. And I know, and statistically, if you were to look at most of those women that have died of cardiac disease, most of them are not on hormones at all. Mm-hmm. And had been on hormones, they probably would have maybe not had any cardiac problems. Or, how many women are we now putting hip replacements in and knee replacements because they have osteoporosis and brittle bones? And I know statistically 80% of those people we would save from having to have major bone surgeries from if they would just start early hormone use. As far as starting hormones, I know people don't think you can start hormones if you still have a period, but that's not true, right? If you're perimenopause and you're having these symptoms, you can put them on some hormones.
I think it's just a matter of patient-specific symptoms. How is their cycle? Do we need to cycle the hormones with their cycle? Do they need to be? It just really, that's where everybody's individual story comes in, and you take into account the patient's concerns, the patient's cycle, where they're at in said cycle, and what we're trying to accomplish with the use of hormones.
And it's not a one size fits all, right? You really do have to listen to each woman, because some women, you listed off like a whole list of crazy symptoms. So, depending on which symptom is which, kind of goes with what hormone, right? Mm-hmm. I know a lot of times we talk about estrogen. We think of that as like the gas. That's your get up and go. Progesterone is your break. That's what gives you your zen, your calm, allows you to sleep at night. Testosterone is a lot of libido, the want to have intercourse. DHEA, we've talked about, can kind of convert itself, but it does help. And Price can cover maybe some of the creams that we offer, because DHEA vaginally helps with a lot of symptoms like vaginal dryness, UTIs.
Yes. So it's amazing for just rejuvenation effects. It's really going to help with, like she was saying, pH balance, with making sure you don't get UTIs, with making sure that intercourse is pleasurable and not painful. And it's a super easy product to put on. You just basically apply what you say, clip the anus.
Clip the anus, pea
And-
size. I put on my finger. I love the Julva. I use that. I actually was using it twice a day because I have been able to really rejuvenate my vagina. Like I now have moisture and brings fullness back to it. I've been able to wean down to once a day and maintain. It's great. It is a little pricey, but I know you have a little bit cheaper option that works just as well.
Yes, so it's a part of this Good Clean Love brand, and so I don't have it on hand currently. It's something we are getting soon though, and it's just called Rehydrate. This is their lube. We'll talk about that in a little bit. But what it's doing is pretty similar, ingredient wise, almost the same thing too. This one I'd say is a little bit better, just with the amounts of things that they put in there.
Okay.
But they're pretty comparable.
Which is why it's probably a little bit more pricier than the other ones.
Yes, yeah, they're doing a little more clinical grade.
I know we also, I mean, DHEA obviously can be put on vaginally, but we can also do it other ways as well, right?
Yes, so we have a liposomal DHEA that's just 2 squirts under the tongue, similar to what we were talking about last week. You just kind of swish it around in your mouth for about 60 seconds and then swallow, and you're done. It goes straight to your bloodstream, and then it can convert itself into really whatever other hormones that your body is needing in that moment. So it's not for sure going to convert to anything specific. It can be converted into a bunch of different hormones, but it does help just for giving people excess to go off of.
And I imagine that might be like one that's really good for people in perimenopause, that they're kind of all over the place and just need a little bit of support.
I do recommend that one a lot for that reason. That way, depending on what they're needing, varying day to day, where they're at in their cycle, that will either convert to estrogen, testosterone, and kind of really just help wherever is needed.
Okay. And I know like before we really got into hormones, ashwagandha was like really everybody's go-to for night sweats.
Yes.
But what does it, I mean, I know it helps a little bit with that, but obviously putting you on progesterone definitely helps with that. But what does ashwagandha really do besides that?
And so what it's really helping with is kind of similar to progesterone. It's the Zen. It's cutting your cortisol levels over time. And cortisol is another hormone. It is important, but people usually get into too high of a cycle of cortisol, and that takes away from other hormones. So cortisol will convert testosterone in men to DHT, which leads to hair loss, all of that stuff. So it's amazing for helping basically just get out the excess stress and help lower that hormone, which in turn helps the other ones get basically the boost that they need.
And I know DIM does that as well, right?
Yes, so DIM is really good for it's basically it's a methylator for excess estrogen in the body. It can do it for other hormones as well, but most of the studies they've done it on is specifically estrogen, and it works amazing for it too, because as we know, people generally become estrogen dominant later on, and this is the number one product for really making sure that your estrogen levels stay nice and healthy, and that your progesterone can bounce back and be balanced with the two.
And that one I do use quite a bit because when we ran my labs, like my estrogen was really high, but I started the progesterone, which drops it down because it's going to even it out a little bit. Which then I got the cream and was putting on the cream. But because I'm perimenopause, I probably released a little bit of estrogen about a month ago because my ovaries are still spitting out once in a while. And it got high, and I was able to not do the cream for a couple of days, take my DIM, bring that estrogen down. So again, it's about learning your body as well, because I mean, everybody's ovaries are going to squirt out. It's kind of like when your pancreas is starting to go on, you're turning into a type 1 diabetic. Like it doesn't just stop and go cold turkey all at once, right? Like I imagine doing diabetics right at the beginning can be hard as well.
I feel like that's one of the hardest part with women's hormones and why it's been underlooked so much, is that that there is so many different stages and cycles going on that with men it's easy, they just throw testosterone at them. With women, we've got to be more careful, figure out everything they're going through. We have to ask all the questions. We can't just throw all of these hormones and say you're good to go.
Right.
Yeah, I think that's where it's important that you check like the full labs, you listen to all the symptoms, you really get the entire picture instead of just chasing symptoms of like, oh, I feel depressed, or oh, I'm having hot flashes, oh, I just have no libido. Like instead of just focusing on one or another, you take all of these symptoms as a whole, recognize it as pre, post menopausal, and come up with an entire treatment plan. Check the full panel labs, the thyroid, the cholesterol, the blood count, liver, kidneys, an entire hormone panel, and just look entirely big picture before coming up with a treatment plan on what to focus on.
And then let's say, like, if I come to you with postpartum depression, and instead of putting me on, Wellbutrin or one of those, and you fix my hormones, maybe give me a little progesterone or estrogen or whatever I'm low in, but then my hormones are good, but I'm still now having depression. Now that would be the indication, right?
That's my approach to it, yes. Or even like maybe you are still having a little bit of depression or various symptoms. Instead of also just looking straight to pharmacological options, maybe there's a supplement, or maybe like we need to, Price said, bring your cortisol down, or the stress response, like what else is going on that we haven't addressed yet that could be fixed.
But then again, that's talking to your patient and realizing what's going on, that, maybe there's been a death in the family or a wedding,
Right.
or, I mean, there's 1,000 stressful events
Right,
that we all
or-
go through.
Yeah.
And HRT is not just like a one time, here's your dose forever. Our bodies are constantly changing, hormone levels are changing, like adjustments may need to be made. It's not like a set it and forget it type of thing, at least not in my approach. I think yes, labs are important, and we do have normal ranges for a reason, but I also think it's important that we look beyond the normal ranges and we treat the patient and not the number. And so, yeah, your HRT labs may be normal, but if you're still having hot flashes, depression, weight gain, whatever it may be, it's important that we address that as well beyond just
Well, I
what's on
know, like,
paper.
testosterone is one of the ones, just because it has like a huge range for being normal,
For
but
men.
not optimal. Yeah, especially for men. I mean, they can be, anywhere from,
The
700 and be normal, but optimal is actually like 1,100, right? So, I mean, women's hormones, same thing. Like, there's a normal range, but there's still an optimal place where you would want to be, right?
And like you were saying earlier, is everyone's different. Everyone's ovaries are working differently, and they're all in different stages too. So again, that's why all of that stuff you were just talking about is so important.
What's in the big box?
Perfect. I was just gonna bring that up. So it's called Feminescence Pro, but it's Maca Go. And so it was one of the biggest things at that women's conference that they were really, really talking about is this. There's about 16 different types of maca. There's tons of different colors to their root system. And that's what you're getting out of it is basically the different I can't think of the name of it, but what gives them their color. And so they picked 3 that they have found work better than really anything else on just helping with estrogen progesterone levels in women. And then same with with hot flashes, night sweats, most of the symptoms of menopause, they've at least proven that these will make it much, much better or take them away completely.
Now, is this maca? Because I know we've had maca that you can drink. Are these like things that we put in water, or do we
So this
pill?
one is just a pill. I
Okay.
didn't love the flavor of it, so I went with the capsules that I could find. It's just as good, but it will not taste gross and grassy.
Yeah.
But really the biggest thing they were saying is even if you're not comfortable for whatever reason with getting on hormones and you're having those issues, at least get on specifically Maca Go. Normal maca is great for you, but it doesn't have the specific benefits that those 3 have together.
We're getting close to time, so do we have any questions, Dominique, from viewers that we could answer?
I have a good one. Why am I gaining weight even though I haven't changed anything?
That's a loaded question.
Let's keep it related to hormones.
I mean, I guess the brief short answer would be perimenopause, postmenopause in that realm. Low estrogen causes central weight gain, to keep it short and sweet. I mean,
And that's usually your belly fat, right?
Yeah.
The women that just gain it
Yeah.
right there in the belly.
weight gain in itself, I mean, there's a lot more that goes into it, especially when you start talking hormones. Have you become like metabolically unequal? Is there some insulin resistance? I mean, there's a lot more that goes into that. And I think that requires a deeper investigation in itself beyond just hormone conversation. I mean, when that is brought to me, I typically will kind of dig deeper into like the insulins, the thyroid, the hormones, and look all together and see like what the best approach would be. Do we just need to start HRT therapy? Is it something where HRT mixed with like a GLP would be beneficial? It really just depends on, again, the patient's story, the concerns, what's most important to them, what do we need to address first.
All right. And you guys have kind of talked about it, and like we're talking menopause and perimenopause. But can you let the viewers know, like, what's the difference? What is perimenopause, postmenopause? Like, what are the differences? What does that mean?
So perimenopause is like your cougar puberty.
Start.
Yeah, the start of it. So you start having some of these symptoms that we've talked about, just the low libido. You can have the hot flashes, mood swings, decreased energy, brain fog. That's what I noticed. You can have a little bit of urinary incontinence that maybe wasn't normal prior, and now all of a sudden, if you've had babies and you cough and it's been normal, but sometimes if you maybe had C-sections and you never had experienced that, now maybe you're coughing or having a little bit of leakage or urgency. That's what I experienced, was like, as soon as I realized I had to go, like I had to go. There was like, I'd be lucky if I could make it to the bathroom without like leaking. So that was what was a big one for me. And then menopause is the stopping of your period. You no longer have a period. And is it a year?
Yeah, it's no period for 12 months.
Month is really what differentiates that peri to postmenopause.
And then kind of tying this into last week's talk with the gut health, can hormones affect my gut health and bloating?
Oh yeah.
And what is there to do about that? Is that just HRT? What are we looking at there?
I mean, I think that kind of goes big picture. And while hormones is a great answer for a lot of this, you do also still need to tie it into gut health. And that's where like the probiotics, prebiotics, berberine, cat's claw, all of that kind of comes into play. And I think that's really why we need, as a society and healthcare, need to get away from the focused treatments of chasing a single symptom and really looking broad spectrum, head to toe, and kind of all the systems, because they're intertwined. And I mean, your hormones talk to your gut talks to your brain talks to the entire body. And so if you're not fixing the big picture, you're never going to fix the person as a whole, and you're always going to be chasing something.
And I know like probably diet really plays into all of that as well, right? I mean,
Oh yeah.
So that's a question I have actually, is can lifestyle changes really improve my hormones?
Yes. I mean, it's already the DIM we were talking about, that only comes from cruciferous vegetables. If you're not eating broccoli, kale, cauliflower, something like that, you should be taking that supplement, in my opinion, because you're not getting it otherwise. So there's tons of different foods that are doing, I mean, so many different things for us. Bioidentical estrogen comes from plants. Same with bioidentical progesterone. Everything's plant-based. We can get all of our hormones from pretty much what we're eating. But let's say we're eating, like we were talking about last week, hyper-inflammatory, super processed carbs, processed sugar. We then need those extra things to help fix the damage that we've done. Just because you can't go years hurting your body systems and then just expect one specific thing to fix it for you. In my opinion, it has to be well-rounded. It has to be nutrition-based as well as medical-based on working on your symptoms. Usually supplements help out, but I feel like it has to be everything together. You can't keep eating like garbage while trying to fix your issues.
So when you say if you're not eating cruciferous vegetables, do you mean like, I have broccoli maybe like once a week? Is that enough?
No, I mean like 2 servings of fruits and vegetables a day, bare minimum.
And I know, like, I mean, hormones are excreted through our waste, right?
Oh yeah.
So if we're not having good bowel movements,
Then we're not
We're not-
detoxing our hormones. Yeah, we're not excreting anything. So
so I mean, even if you take the DIM and you're lowering it, if you're not
yeah, it's
having
just
a
stuck
bowel
in your small
movement, it's
intestine.
still not really helping either. So I mean, diet does have to play a role because you got to be able to have a bowel movement.
Oh yeah, yeah. You have to be able to detox.
Okay, this is a pretty good question. It's kind of loaded. I know we talked about it a little bit, but I have a friend who is on hormones. I talked to my doctor about it, but they're very much against it and don't think I need it. You know, you guys talked about how there was that study done that kind of put in that fear in a lot of people and a lot of providers. Maybe you want to talk a little bit about like your right to choose as a patient as well, on top of that, and how you do have a voice as a patient.
Well, I mean, if your doctor's against it, my answer is find a new doctor. That
I'm not gonna say it.
yeah, I mean, I know you're not, but that would be that's my
Yeah, if your
feeling. If my
doctor's not
doctor's not
listening,
gonna listen
no.
to me and help me understand why I should or should not be on it, get a second opinion, find a new doctor, or you can come to Revive and meet with Mariyah. I mean, lots of med spas, wellness clinics offer HRT, which is hormone replacement therapy. The acronym for it. We'll walk you through it and why it is so important and show you the study. I mean, anybody can read the study. It's the World Health Initiative, or women. Sorry, thinking. Yeah, the Women's Health Initiative, and you can read it. It really, they went in November and debunked it. I mean, there was a national news coverage on it that the director of the FDA came on and said, we actually knew it was a bad study back then, but the genie got let out of the bottle and it just spread faster than they could even put a cap on it. And they let it just kind of get out of control, honestly. And now they've now realized that and realized the damage they have done to thousands and thousands of women and have now released the black box warning. So doctors can prescribe it now, right? And insurance covers it. So you don't necessarily have to go here or to a clinic where you're going to pay out of pocket. Insurance will cover it if your provider is willing to work with you. And there are a lot of great providers that do. There are still some old school doctors out there that just, they learned it that way and they have not changed. So if that's one of your providers, get a second opinion. You're not locked to your doctor.
Well, and one of the biggest things I think it was just yesterday that we were talking about is, I mean, if your doctor's worried or you're worried about the cancer possibilities, first off, like we debunked it, that's specifically horse urine based. But on top of that, there's so many things that we breathe in, that we eat, that we drink, the sun, everything is carcinogenic to us. We've linked so many different things to causing cancer. So if there's one thing that's extremely beneficial to so many different parts of women's health, I say go for it, because you just walking outside for 20 to 30 minutes with no sunscreen is carcinogenic also.
Well, and on the flip side of that too, you got to think like not having enough estrogen or progesterone. Now you have neurocognitive issues. There's Alzheimer's. There's osteoporosis, cardiac disease, heart attacks, strokes. I mean, obesity. Obesity complications are going to kill you.
Yes,
I mean,
the benefits are just absurd.
Risk versus benefit, honestly, and you got to again look big picture at what you're trying to accomplish.
Well, and I mean, how much red dye 40 have we been eating this country?
Red dye, yellow dye, blue dye.
Right. I
green
mean,
dye,
we don't
yeah.
we don't think of the Cheetos killing us when we're shoving
Not
food
at
down
all.
our face, but we're worried about some estrogen that has proven to be cardioprotective, to be brain protective, to be bone protective, and we know we need them. Like we were born with hormones.
I mean, it goes along with the GLPs too. It's the same
Yeah.
argument that, I mean, you win some, you lose some.
But that's my biggest take, is if it can do so much good for you, then I wouldn't be scared of the one little thing that they've already proven was just a myth
That's a
anyway.
hill I'll die on.
All right, let's do one more question. So how long does it take for me to feel better once I've started on my HRT?
Depends.
Yeah, it really depends. I mean, for myself, I noticed it probably within 3 or 4 days. I noticed a little bit of change. One, I started progesterone. I actually did pee a little bit more because has a little bit of that and the DHEA has a little bit of diuretic effect. So I did notice that was probably the first thing I noticed. But I did notice the brain fog lifted fairly quick. Probably
like a
within
week.
weeks. Yeah.
It was a crazy difference.
Yeah. Huge. I mean, I would walk into a room almost every day and not remember what I was doing. And that changed very quickly. Libido probably took me maybe a month to really feel like that desire, but the dryness with the julva, that was pretty quick too. I would say within a week, I noticed a huge difference with that, and vaginal dryness and just feeling more comfortable down there. My pH balance was off too, which we realized because when I put that on, it was a little spicy. And I was asking all the other girls, and they're like, no, it shouldn't be spicy. And Price was like, your pH is probably off. So I did do a pH test, and he was right. I was off. So I did get on a good probiotic, which I guess.
We have here.
Yeah, I mean,
one thing I didn't go over is we actually now have vaginal probiotics, which really they work a little bit faster because you don't have to eat and then digest and hope that it goes down to the vaginal cavity. This you just put with there's just a little syringe that you pop it right in, and then it's right where it needs to be. It usually fixes the pH within about 1 to 2 weeks. But even with that probiotic, the oral one, that was pretty quick too.
Yeah, and it's real important to have the good bacteria down there because that's another first line of defense, right? I mean, you have.
Oh yeah.
It's an opening, right? I mean, your nose, your mouth, your ears, like those are all openings into your system, and your vagina is no different, right? I mean, if your pH is off and the bacteria is not going to be able to fight off the bad bacteria, I mean, if your good bacteria is not going to fight the bad bacteria, then you're honestly more susceptible to UTIs, vaginal infections, vaginosis.
So for everybody watching, that one that you just talked about, Price, that is a suppository. Correct?
Yes, that was a vaginal suppository.
Also, I see that BioNude, BioMatch, Good Clean Love right there. I don't think you guys really touched on that.
I forgot to bring it up all the way. So one of the most important things that we learned at that conference definitely was that you need to use a pH balanced lube that's pH balanced for the vagina. Just because sperm is alkaline, so that's already not helping the situation. But on top of that, most lubes are not pH balanced, so they are messy. They're going to give you a UTI or they're going to give you a yeast infection because they're messing with your pH.
Right.
So you'll notice that there's no itch when you use this lube. There's no dryness, no flakiness. It's really good quality, but it's also going to make sure that the vagina stays healthy.
And I know when we can get into it more when we do women's sexual health, but if you're going to have penetrative intercourse, you really should have a lube because only 10% of all women in the world will only get a good moisture down there to lubricate themselves during intercourse. And out of that 10%, it's only 10 days out of the month. So unless maybe you are of that 10%, but you only have 10 days out of the month that you're actually lubricated enough to have penetrative sex. So a good pH balance lube is so important because that's going to help prevent any microabrasions that also open you up for infections as well. And as you age, the walls of your vagina actually become a little bit thinner, and that's why you can have that painful intercourse. So doing the julva helps rebuild some of that and thickens that lining, but using the pH balance lube will make that a lot more comfortable too.
And one last thing before we wrap this up, Price, do you mind running through each product just really quick and giving like a really quick bullet point of what that's for?
Yes. So I'll start with the one we just had. So pH balanced water-based lube, making sure that everything stays nice and healthy. Reset is a vaginal probiotic that's going to help exactly what it says. It's going to help fix that pH. Ashwagandha is going to help take down that cortisol level. It's proven that it does it by about 36% in 8 weeks, which is amazing in my opinion. And then there's DIM or DIM. This one's going to take out your excess estrogen. Feminescence Pro is going to be Maca Go. That one's going to be amazing hormone support and help with hot flashes, mood swings, all of that good stuff, brain fog. And then we have Peace Serum. So this is just basically it's a lower dose progesterone that you put on your wrist that's going to help with, again, hot flashes, night sweats, getting a good night's sleep is really what it's for. And it absorbs straight through your wrist or inside of the elbow cavity. And then we've got that pure DHEA. This is going to help turn into any other hormone that your body needs at that moment. We have core hormone support, which is going to be DHEA. It's going to have that DIM in it, and it also has pregnenolone. So that's another precursor hormone that's helping turn into a few other things. But that's just a good combo to, again, if you, for whatever reason, don't feel comfortable doing HRT, there's still different options as well that'll help give you at least something. And then Jova Pro, that's going to be the one that is really rejuvenating to the vaginal walls, helps with that pH as well. And then we have Velve, which is going to be that same company. It's an aloe and water-based lube that is also pH balanced in a fancy little glass bottle.
Awesome. Thank you.
Well, I'd like to thank you all for joining us.
Yeah,
I know this was a quick rundown on hormones, kind of down and dirty. There's obviously, we could probably talk for hours, days, honestly, about hormones. But you can always schedule an appointment here at Revive, and Mariyah will be happy to sit down and talk to you and figure out what you need and get you on the right path for hormones. If you're not looking for the HRT, but maybe, a supplement that will help you with that, Price is always here and willing to talk to you. I'm the nurse on staff and also willing to talk to any of you if you have any questions. Our next Revive 360, we're going to be taking a couple weeks off because of the Christmas and the holidays, but we'll be coming back to you at the beginning of next year. And we'll be doing GLPs. Everybody's favorite.
Perfect time for it.
Yeah, everybody's going to be ready for weight loss after the holidays, and we're going to talk GLPs, our favorite thing to talk about. We love. Well, that's probably our first, but GLPs are definitely our second. And Mariyah is actually doing her doctorate degree on GLPs that she'll be finishing up here in this next year. So that's really exciting for her and for us as well, because she's really the Valley expert on GLPs. I don't think anybody will have a doctorate on their GLPs in this Valley. So she's very quickly become the weight loss nurse practitioner and hormone therapist. So we are so excited to bring you the GLPs. I think if you have any questions, knowing that you're even thinking about it for the new year and want us to answer those questions, please submit them to admin@azrevive.com. So that way we make sure we hit that topic for sure, because we don't have a lot of time. We try to keep these to 30, 40 minutes just so you guys can get a little bit of information out there and know what to ask us. But if you already know a question, we would love to have that answered. You can also go to our website at azrevive.com, and all of our products and services are on there. You can book online as well. Our link to our Facebook and social media accounts are on there as well. And make sure you like us on YouTube.
Oh, yeah.
Dominic usually posts a lot of our sales and all that content on Facebook, so you can see what we're offering. I think we're doing Revive Bucks this month, so you can spend them for next month, which is great. I think it's $10 off for every 100 you spend. Yep. So it'll be a great value for next year when you're ready for your GLPs.
Yeah, make sure to hit that bell and subscribe too.
All right. Thank you for joining us. We look forward to seeing you next year.